Hi, this is Dr. Praveen S. Patliha. Today I am going to talk on necrotizing fasciitis. By definition, necrotizing fasciitis is nothing but the soft tissue infection. It's a soft tissue infection spreading along the facial planes with or without overlying cellulitis. I repeat, it's a soft tissue infection spreading along the facial planes with or without the cellulitis is called as necrotizing fasciitis. Coming to risk factors, any immunocompromised conditions like diabetes, immunosuppressive drugs, malnourishment, peripheral vascular diseases where the nutrition is unable to reach the tissue, and underlying malignancies, obesity, etc. are the risk factors for development of the necrotizing fasciitis. Coming to the classification of the necrotizing fasciitis, is classified as polymicrobial, monomicrobial, marine, vibro, vulnificus, and MRSA, methicillin resistant Staphylococcus aureus. Among these, polymicrobial is the most common type, which is seen in 80 to 90% of the necrotizing fasciitis. Monomicrobial is hardly 5% and 2% of MRSA. In polymicrobial, so multiple more than four variants of organisms are cultured. In monomicrobial, only one single organism is cultured. Coming to the clinical presentation, inflammation of the skin and the symptoms of sepsis are the classically seen clinical feature. Patchy discoloration of the skin with pain and swelling without defined margin. Patchy discoloration is considered as the a classical presentation of the initial stage of necrotizing fasciitis. Grayish brown discharge, sometimes in the initial stage vesicles and bullae are seen and necrosis is seen and crepitations are seen on palpation. Coming to the investigation part, investigations help us to diagnose the condition or to assess the severity of infection, severity of the condition. Laboratory investigations like CBC, total count, platelet count, and diabetes, HIV infections. So this will help us to understand the severity of infection. Culture will help us to differentiate between the polymicrobial, monomicrobial, and MRSA. Imaging has limited information which gives us to assess the condition. Coming to the treatment part, so antibiotics and operations. So antibiotic has major role in treating the necrotizing fasciitis, and once the tissue is badly involved, then surgical debridement is needed. Initially, before the culture report comes, so multiple drugs has to be administered like penicillin, clindamycin, and metronidazole. So as we know, this polymicrobial is one of the classification of the necrotizing fasciitis. So initially, before we get the culture report, we're supposed to treat it as a polymicrobial only. Penicillin G for Streptococcus or Clostridium. Penicillin G. So this if it is comes as a monomicrobial, then a penicillin G will help us to treat the Streptococcus or Clostridium. Imipenem will help to treat the polymicrobial and vancomycin if the MRSA culture is isolated. So this is about the necrotizing fasciitis. If you like this video, then kindly subscribe to channel and press the bell icon and kindly forward to the needed people. And if you like to see the debridement of the necrotizing fasciitis, the link of such video is given in the description box. Thank you. Thanks for watching my video.